The NFL playoffs kick off this weekend, and our chief medical contributor is here with all you need to know about a common football injury.
We're talking all about knee injuries, if you didn't pick that one up. So, Doc, what's the best way to manage them?
Yeah, I'm not quite sure that I can follow that up. After watching that dribbling and that weird joke, I think that we're downhill from there. So the knee is one of the most common injuries we see in all sports and in common life. Most commonly, and for most of us, a hyperextension of the knee will cause a strain or injury to one of the ACL or the PCL, lateral hits or medial hits in football, especially causing injuries. But for most of us, what do we need to do? Now, it depends on what the actual injury is. Is it just a simple inflammation like a tendonitis or ligament-based strain, so muscular-based injury, or the ligaments themselves? Or are we talking about something that is more of a strain or tear? Now, if it's completely torn, if you're not really into athletics, if you're not doing tennis, basketball, things of that nature, you really don't necessarily have to have it fixed. It is still relatively stable just because the muscular structures around it. But if you are into athletics or you're very young, just like Krista, you may get it repaired because you need to have that stability as you move forward and continue to have those athletics. Now, a lot of the things we need to do is the expectation that you're going to have swelling, inflammation associated with that injury. So, with that inflammation, icing it, compressing it, getting rehabilitation, evaluated, and in potentially consultation with an orthopedic surgeon to see if it needs to be repaired or if it's something that can be maintained with more rehabilitation services, such as physical therapy.
Doc, I'm always curious about this. When we see the dreaded non-contact injuries in the knee area, is that because the knee is just worn down or too much weight on it? What
so mine was
that?
actually a non-contact that I had in college as well, and it was hyperextension on artificial turf. So actually came down, knee went backwards, had a strain associated with it there, fixed through physical therapy, not through surgery. But it depends. It all depends on the angles that our legs hit, especially when it comes to surfaces that aren't giving, such as artificial turf. That's why we worry about that a lot. A lot of knee injuries on artificial turf, even though the new technology is getting a lot better.
And real quick, does the rain actually affect your knees?
Well, the rain does, and actually we have talked about it. You can feel the changes in pressure associated with low pressure and high pressure systems after injuries because of the expansion of the joint.
Great information.
It's not just a hoax.
We're short on time. Do you want to apologize to me now or in the commercial break?
No, let's do it next week when I come back.
I'll hold him to it. Dr. Ryan Stanton with great information and criticism of my bad jokes.
And maybe better jokes.
I like the first part. Back to the final half hour after this. Get out of here.
You're watching Fox 56 News. Our home, your news.